when I was growing up and I was asked the question as I went to high school, as I went to college, what do I want to be? I would give various answers. At one point in time, I thought it was an attorney. At another time, I actually thought I wanted to be an engineer. I actually wound up going to school as a pharmacist. And that's really what I thought I wanted to do. So I went into pharmacy, got a pharmacy degree. I decided that I wanted to do research. I actually entered a program up at UC San Francisco to get a PhD in pharmacology. And it was really there as a graduate student that I began to take courses in the medical school. And that exposure to the medical school courses, just a green light went off telling me that this is really where my passion was. This is really what I wanted to learn more about. I just knew when I started studying medicine that medicine was so broad, it was a key to a lot of things. People, and I tell my children this, once when you go into medicine, folks just think of it as clinical medicine, treating patients, surgery. Medicine is so much more. It's about the mind, it's about the body, it's about how they come together. And in order to understand that, you have to understand your environment, because your health is tied to where you live, who you live with, who raises you, what part of the country or world you're raised in. So it's not just heart, lungs, and kidney. It's all about the environment. You know, my passion is really sounding the alarm to the African American community. There is a crisis in healthcare, and black folks are in a crisis as far as healthcare. And it's killing them. It's killing them much earlier than they need to be leaving this planet. Our children are dying younger. Adults are dying much younger. And my passion on the verge of anger is that we talk about it in terms of numbers and statistics, but when you really look at the numbers and statistics, I believe we should be very upset, angry, moved to action. But I don't see that happening enough, and I think there's lots of reasons for that. I just think we're too apathetic about our crisis. First of all, the concerns I've had aren't new. It would be, you know, like if I could say the past 20 years we've developed this problem. The concern I have is that the statistics that we talk about in the black community as far as health have been with us ever since we've been in this country since slavery. When we look at healthcare issues, no matter, everybody talks about health disparities, everybody talks about minorities, but the minority group that is suffering the most as far as health are African Americans. When we look at the 15 leading causes of death, blacks lead in 13 of the 15. Cardiovascular disease, cancer, strokes, HIV, infant mortality. When we look at trauma, when we look at violence, okay, it's affecting our communities much more. This isn't something that just happened in the past several decades. There's some friends of mine, Dr. Bird and Clayton, that actually wrote a book called The African American Health Dilemma. And it talks about the historic aspects as to how we have gotten into this condition. Blacks as a group are survivors. Why do we, the question that the African American community has to ask in order to come up with good solutions, we tend to want to jump to solutions before we understand the problem. So everybody talks about prevention. Of course, you gotta breathe air in order to live. Prevention is important. Everybody wants to talk about obesity and diabetes and hypertension and cardiovascular disease. We need to talk about those. Those are important. But what we don't talk about is how did we get into this condition? Because it's not just tied to the physiological aspects that we have more cardiovascular disease, more heart disease. There are whole social, historic structures that have accumulated that has cost us, and we never get out of it. So most of the solutions we have come up with have been temporary or minimal. And I think until we as a community realize how we got there, and that, for instance, what the Urban League is doing about jobs, about empowering the community, I think that the community needs to first of all be empowered to take control of their own health. And taking control of your own health is more than just taking control of your own individual health. You have to take control of your community to make it a more healthy community. We do not have healthy communities. And even when we live in communities that we consider healthy, i.e. if you're fortunate enough to make more money and you're able to move out of unhealthy communities where the violence is high, where more toxic substances are buried, and you move to a community that's healthy. When you compare that black person to his equivalent white, he's still dying much sooner. Why?
Attention! Keeping the seas safe from Somali pirates, Commander Ferdinand Reed.
That's my dad.
Saving villages after a tsunami, Lieutenant Laurie Campbell, Nurse Corps officer.
My mom.
Tracking the enemy, location withheld. Petty Officer David Goggins, SEAL operator.
Our coach. Our mentor. Our friend.
America's Navy, a global force for good.
This subtle, subconscious thing that is very difficult to talk about now called racism that still exists, that psychologically, I think, is affecting our heart, is affecting our kidneys, causing us to die early. And we hold it in and try to find other ways. It's kind of like being black in America. You have to be two people. Okay? You have to have one conversation when you're around your own and another conversation when you're around others for fear of offending somebody. And it's very hard for this country to deal with the truth that racism still exists. Racism is still affecting people of color in very ways that are detrimental. And I am convinced that that is not going to change until the African American community not only becomes aware of it, because I think they're aware of it, they haven't figured out what to do about it. They haven't empowered themselves to say, we're not going to take it anymore. That's why I'm so proud of the students at UCSD. They, in essence, say, we're not taking it anymore. I don't see that happening enough in our community, especially around the issues of health. We act like we're second-class citizens in health. I was given a lecture similar to one that you heard on the continent. One of the African brothers came up to me afterwards and said, you know, Doctor, that was a very interesting lecture. But when I was in America, African Americans seem to have it good. You know, they have getting into college. And I said, well, you know, that may be true. But since when was it okay to be a citizen of a country and be satisfied to be the best second-class citizen rather than being first-class citizen? We should not accept second best, and I think we have. We are. The other thing about the African American community is they need more folks like Barack Obama, who are cool, calm, and collective. But they need more folks like me or Malcolm's or other folks who get angry. That's okay. And express that. We need to know that this is all part of the same community, and really we need each other. Okay? Because sometimes it's the outspoken who are willing to say things that nobody else is willing to say the white community as a whole may say, we don't want to deal with him, they're too militant. But then they'll look at the other folks that they don't consider and do exactly what they should be doing with them. So it's a yin and yang. First of all, I think we're apathetic for a lot of reasons. Number one, we don't know the full extent of what the problem is. When we do find out about it, it's presented in such a negative way. We get so tired of these negative images of blacks. You know, blacks have the worst this, blacks have the worst that. So there's this centuries of beating down of, I don't want to hear any more, all I want to deal with is the positive. So they keep trying to deal with the positive, but they haven't resolved the negative. So I think that's number one. Number two, I don't think we as a community have know who we are. More importantly, I don't think our children understand who we are. And I think we need, as a community, to make a concerted effort for us to educate our children, not just about so-called Black History Month, not just about our history in America and the George Washington Carvers and the Booker T. Washingtons and the W.E.B. Du Bois. Those are some very important people who have helped us through the struggle. But if you look at many of them went back to Africa. They were seeking knowledge of who we were prior to that time. That history has been taken from us. And we do not discuss that history or really have knowledge of that history as to who we were before we came here to make that connection. I think that there is a collective self-image of low self-esteem that still exists, even those of us with MDs and PhD degrees. And somehow or another we need to have a collective way of breaking through that, and especially instilling that in our children.
From a community perspective, is to have an organization where the people in the community see it positively. I think it is very, very important that, you know, the African American community sees the Urban League as a beacon of hope, where you can go and see the best and the brightest at the Urban League, where if Al Abdallah steps down as the board chair, someone else steps up who is just as passionate about making sure the Urban League sustains itself going forward. I think it's critically important that from a board perspective and also even from the CEO perspective, that we get the best people in the community to be a part of this. Because again, we do represent the community.
First of all, it is true that our health status, or anybody's health status, probably the majority has to do with your lifestyle. What you eat, what you do, your exercise, where you live, but also what you think, and your perception of life ties into your lifestyle. And I think that we have to understand our unique history, because there's some data. For instance, when we look at hypertension, for whatever reasons, is extremely high and more severe in African American community. When we look at blacks in Africa, that's not true. What happened to us? Okay, what happened? Is it a lifestyle? Is it inherited? Or is it a combination?